At Hope, we want to make sure that we create a safe space for our missions and our ministries. So in this video, I'll be taking you through some ways that we can be prepared if emergencies arise, and in particular, fire emergencies or medical emergencies. One of the most important things that you can do if there's an emergency is to make sure that 911 is called right away. If you aren't able to do it, make sure that someone else is doing it. Don't assume that someone is. And if you happen to be deep in the building helping someone and you know that the doors are locked, if you can send someone out to help guide emergency personnel in, that's fine. But if not, they are able to get in because there is a lockbox just outside of our door. Fire departments have a master key to this. They can open this box, and this box has keys to the building. First, let's talk about fire exits. There's the two obvious ones. The way we usually come in down at that end of the narthex. The exit right here on the other end of the narthex. And if we go down the stairs just a little bit further, there's an exit right there, which could be a good way out if you need to coming up from Fellowship Hall or the kitchen. There's a way out of the sanctuary from either that door or that door, which will take you down a small flight of stairs to an emergency exit, which I'll show you. If we come in from the front right side of the sanctuary, notice that there's an escape sign here. If you open this door, there's a small flight of stairs and an emergency exit right there. If we come in from the left side of the sanctuary, notice the sign directing us down. It's just another way down to that same door, out through a flight of stairs. If we're down in Fellowship Hall, notice that there's two exits here right on the stage, and those will take us up a little flight of stairs to that same door. Also, to exit Fellowship Hall, you have a number of choices. You can take that exit, take that exit, or you can go up the steps this way. But we don't want to use the elevator in the event of a fire. On the second floor, there's a fire escape exit off of the sewing room right there, and that'll take you to the external fire escape. And finally, there are fire exits up on the third floor. Both of these doors go to the same room, which goes out to that exit there, which will take you to the external fire escape. In the case where we have to evacuate very quickly, and we have people who aren't able to do the stairs, we have stretchers in the outer office here and down by the kitchen that could be used to carry people out. So these are basically tarps with 8 handles on them. So other ways of getting people out would be to seat them in a chair and have people on either side and perhaps in front and behind to help guide them out by sitting in the chair, either this way or this way. If we need to evacuate the building, we'll need to gather in one place, and that should not be in this parking lot. Emergency vehicles will need to use it. So we will need to go down to that parking lot so that we can account for everybody. If you have a small fire, you may want to try to use a fire extinguisher. These lift off the wall very easily. They have a pin that you need to pull so that you can squeeze the handle. The nozzle gets unlocked there. You point it at the fire, you squeeze, and you sweep it across the base of the fire. Don't try to do this if you have a big fire, and still make sure that the fire department comes, because they can inspect where the fire happened to make sure that it's not going to rekindle, and they can also use their big fans to get the smoke out of the building. You'll find the fire extinguishers on either side of the main entrances to the sanctuary. In the narthex, one there and one there. And then in the sanctuary itself, there's one in that corner and there's one in that corner. In case of a kitchen fire, there's a fire extinguisher right next to the door here on the inside. And also, there's a fire extinguisher next to the other door on the inside. In addition to that, there's a fire blanket that's right up here on the cabinet. In the event of a large fire over the stove, there is a hood here with a fire suppression system built underneath it. And to activate that, you do it right here next to the door, underneath the fire blanket here. You pull the pin here, and then you grab this handle and you pull it hard, and that will activate that system. Also, there's a fire extinguisher right here, just outside the serving area. If you need to get to a fire extinguisher on the second floor, they are just outside the balcony on either side. Here's one of them, and here's the other one. On the rare chance that you're up on the third floor, there are two fire extinguishers up here also. On the inside, one on either side of this room. There's a first aid station in the main office, just to the right. Over in here, you'll find a defibrillator for heart emergencies, a first aid kit, and there's also a stretcher for helping to evacuate people out of the building during a fire, Narcan, and a tourniquet. Just inside the kitchen, to the right here, is another first aid station. Here you'll also find a stretcher, Narcan, and a tourniquet, but there is, in addition, a choking rescue kit. We have only one defibrillator, which is up in the main office. So if you do need that, you'll have to run upstairs. The first key piece of medical equipment that I'm going to talk about is the defibrillator, which is in the outer office here. So I'll open this up so that you can see it. Even if you do not know CPR, it can still be helpful to apply the defibrillator. It may be able to help the person, even if you are not able to do chest compressions or other things. It has an outer bag to it. In here is a pocket mask for doing rescue breathing, if you know CPR. And notice that it also, in numerous places, says call 911. That's very important that gets done right away. I'm going to open this up so that you can see what's inside. The operation is actually pretty simple, and it talks you through it. So as soon as you take this, where it says pull, if you pull that down, it will turn this on, it will start talking to you, it will tell you to apply the pads, which are right here, to the patient's chest, and you can see where they need to go. It will analyze the heart, and it will tell you that if you need to apply a shock. If you do that, the orange button will be flashing. You'll want to make sure that everyone is clear of the person. You apply the shock, and it will tell you when you can resume CPR or if you should not resume CPR. There are also some shears here, just in case you need to cut away some clothing, because these pads need to be applied to bare skin. The next thing that I'd like to talk about is Narcan, and that's in this package here. And this you would use if you suspected that somebody had an opioid overdose. So there are 2 nasal applicators in each one of these packs, and they look like this. And if you suspect that someone has had an overdose, they're still breathing, but they may be unresponsive, you can insert one of these in one of their nostrils and push the plunger. And that will release the Narcan into their body so that they can begin to recover. Make sure that you have 911 activated, though, of course. And if about 2 or 3 minutes passes, if they are not here yet, you can apply the second dosage to that person. Don't worry if they're not having an opioid overdose and you give them Narcan, it will not hurt them. Tourniquets are a very effective way of stopping severe bleeding. And we have them in our first aid areas at Hope. So this is what they look like. Notice that there's a red tab. We're going to open them up. They're big enough to fit around a leg or an arm. Ideally, we're going to put it on bare skin, and we want to put it about 2 inches above the wound. We want to make sure that it's between the wound and the heart so that blood flow can stop. So in this case, I'm going to tighten it up. I'm going to slip it over my arm and keep tightening until I get it nice and tight. We would not want to put it over a joint either. So make sure that it's above the wound but not on a joint. So in this case, let's say my wound was right there. Okay, so after I have the Velcro nice and tight, there's this bar here that I'm going to keep turning this around and around until the blood flow completely stops, and then it will lock into here. In the case of a person choking, back blows and the Heimlich maneuver are still very good techniques. But we also have an additional tool for the toolbox, and that is a suction device. So there are directions on it, but I'll quickly run through what they are. So we have this device, and to that, we're going to attach a mask. So the mask just goes right into there like that. This goes over a person's nose and mouth like that. Get a good tight seal, push in, pull out hard. Push in, pull out hard. And keep doing that. And we want to make sure that we have emergency personnel on the way, but don't worry about pushing the object further in when you push in, because there's a special valve here that doesn't allow air to go back into their mouth. It will only pull out of their mouth. So don't worry about that. Just keep pushing and pulling hard, pushing and pulling hard. So there we are. Lots of things that we pray that we'll never need, but if we do, we'll be ready. Thanks for watching.